Hi, I'm Dr. Priyanka Reddy and welcome back to DNA Skin Clinic. Today I would be talking about injectables, that is the Botox and fillers. Well, a lot of you are already familiar with these terminologies, but again, a lot of you, at least most of my clients before the consultation, think these procedures are one and the same. So fillers and Botox are anti-aging procedures and they're one and the same. That is what a lot of people think. So this has probably got something to do with both these procedures catering to anti-aging, and both the procedures, the way the procedures is done is via injections. So probably this is the reason why a lot of people get confused, but let's get this straight. Botox and fillers are completely different procedures. The product that we use is completely different. The mechanism of action of this product is completely different, and the results that they deliver is completely different. So Botox and fillers are different. Yes, we often use these procedures during the same session and synergistically to attain a certain result, to attain the contour result or to attain the anti-aging procedure result. But again, like I said, these are completely different. So let's get into each of these procedures and understand how each of these procedures deliver what they deliver. Fillers. Fillers is an anti-aging injectable procedure. Is fillers only an anti-aging procedure? Well, this is the biggest myth surrounding fillers. A lot of people think fillers is only for anti-aging. Well, fillers, the truth about fillers is fillers can be done across all the age groups and has no gender barrier. Well, when I mean across all the age groups, we do not do any cosmetic or aesthetic procedure till a certain age. Now, the cutoff age depends on the procedure that we do. So, we essentially wait till there is complete growth of the bones and the fat paddings or cushions are in place. So, we wait till the face or the body reaches its complete growth level. So, yeah, again the age cutoff depends on the procedure that we do. But again, till you reach a certain age, and after that the fillers can be done across all the age groups depending on the indication. So, what exactly is a filler? So, filler contains a substance called hyaluronic acid. Now, hyaluronic acid is normally present in the body, but when we inject, it's a synthetic product. So this product, when injected under the skin, causes plumping up or volumizing the tissue. In short, fillers in younger age groups are mainly done to get a contoured look. So it helps in treating the sunken eyes, to get a sharper nose, to get more fuller lips, to get the pointed chin, and to have a nice contoured jawline. Fillers as an anti-aging procedure helps in treating the aging faces. Well, in one of my previous videos, I spoke about how aging affects the face and how it changes the contours of the face. Well, just to summarize, a face that is synonymous to youth or a youthful appearance is having a triangular face which is broad at the mid face. That is, the mid face is the broadest part and which has a narrower lower face. So now this happens because of the bone structure and the fat cushionings in the mid face. Now that is changed as you age. There is loss of volume, there is loss of fat, and there is also receding of the bone, which causes accumulation of the fat on the lower face. Now this causes appearance of the face like in the shape of a square, where there is a lot of fat accumulation on the jaws and the jewels area, or as an inverted triangle which has a broader base in the lower face. So now this happens because of the loss of volume and bone receding. So what can filler do? Fillers can help in getting back the volume on the face. So we inject fillers on the affected areas. For example, like in aging faces, you have loss of volume on the temples, the mid face, and there's also loss of volume on the lips, and there are many vertical lines that happen and the lips appear pursed. So to reverse all these signs, we put fillers on the affected area. So it helps in filling up those hollows. There is also appearance of sunken eyes as you age. So it also helps in filling the sunken eyes. It helps in filling the cheeks. It helps in giving those fuller youthful lips and also treats the vertical lines on the lips. Well, other than face, fillers can also be injected to treat the neck area, to treat the sagging neck, to help in rejuvenating the hands and feet as well. So how is the procedure done? Well, after the consultation with your doctor and after we understand the facial contouring and after understanding the needs, we decide on which areas we need to put fillers and which type of fillers to be used. Now, there are different types of fillers. The material is the same, that is the hyaluronic acid, but depending on the cross-linking of this material, the results can be variable depending on the type of the filler that we use. Now, there are light and easy fillers that can help in nourishing and moisturizing your skin, and there are heavy fillers that will actually add up volume to the areas that has lost volume. So the fillers that we use on the cheeks can be different from the fillers that we use on the lips to the eyes. So we decide on which fillers has to be injected depending on the results that we desire. And the procedure as such is very simple and straightforward and is very safe. So there are certain injections that is preloaded that we have to inject into a certain depth of the skin depending on the result that we desire. So this has to be done in a very sterile manner. So please choose the center and the doctor right. Otherwise you might end up getting infections or much more serious complications, which we'll be discussing a little later. So yeah, choosing the center and choosing the doctor is the key. And having an open heart discussion on what you want, what are the results that you're expecting after the procedure is very important. So after that, the procedure is quite simple, and most of the fillers come with preloaded anesthetic with it. So after the initial prick, the area becomes numb, so it's quite comfortable procedure. The procedure on an average takes about 30 to 45 minutes. It depends on the number of areas we are treating and the indications that we are treating, but on an average it takes about 30 to 45 minutes. And there is no pre-procedural preparation as such. There will be a few questions that your doctor would be asking you to understand if there are any complications that could happen if you're on certain medications, but otherwise there are no pre-procedural preparations that one needs to do for a filler procedure. What can you expect after the procedure? Well, fillers is a simple procedure. Usually because of multiple injections, you can end up getting a little bit of swelling or redness which resolves on its own. Some patients or clients can end up getting bruises. This usually happens when someone are on certain medications or undergoing some laser treatments or have very thin and affected skin, and it's of no harm. It resolves on its own after a couple of days, and in the meantime one can use a concealer, and also using certain topical applications like arnica gel or pineapple extracts can help in resolving bruises much faster. So essentially there is no downtime associated with a filler procedure. Well, how long does a filler last? So fillers can last anywhere between 18 to 24 months depending on the filler that we have used and the area that we have treated. Now there are certain factors that can trigger the faster degradation of fillers. So people who take regular facial massages or get exposed to a lot of steam and saunas, or people who smoke a lot and who have done their lip fillers, so the filler gets degraded much faster. So these are certain factors, but otherwise on an average the fillers should last anywhere between 18 to 24 months.